The Omicron variant continues to spread here in Arkansas as we end the week with another record-breaking day for our COVID numbers. Thanks for watching. I'm Marlisa Goldsmith. We're going to take a closer look at the state's numbers from last week, but first, let's look at what we're seeing today. 8,434 new cases of COVID reported this afternoon, making today the fourth record-breaking jump in a row. As you can see, the last few days have done a number on our active cases. Right now, more than 50,000 Arkansans are battling the virus, and close to 1,000 of them are fighting from a hospital bed. Now, let's look at where we stood Monday compared to where we stand now. In the last 5 days, the state has reported more than 32,000 new cases of COVID-19, and we started the week with a little more than 27,000 active cases. And as you just saw, that number surpassed 50,000 today. As for our hospitalizations, that number has gone up by more than 200 since Monday. As cases continue to rise, so does testing for the virus. Major testing sites across our area have seen some of their longest lines yet, as crowds line up daily to be tested. THV 11's Ian Russell spent the day at one of those sites and has what you need to know.
Testing for COVID-19 has skyrocketed over the past couple weeks in central Arkansas as the Omicron variant continues to spread. Over the past couple weeks here at UAMS, they've seen the daily number of tests they give almost triple, and they're not alone. Car by car, those looking for a COVID test are packing UAMS's drive-through site.
Now we're seeing, 700 or 800 patients a day with expanded hours and expanding through weekend hours as well.
And if you've been trying to get a test recently, you know it hasn't been the quickest thing to do.
Made us turn away or had to shut down our clinic early because we just couldn't get all the patients through.
Dr. Michelle Krause helps to lead the COVID response at UAMS. She says there's tests available now, but lines look like this at most sites.
We have that ability to help offer testing for those in need.
Part of that is due to the National Guard they requested earlier. But what are you supposed to do if you can't sit in lines like these? State health officials say the best bet if you're showing symptoms is to assume that you're positive.
So if people are having symptoms of COVID-19, and they can't get tested, they should stay home.
Dr. Jennifer Dillahay is the chief medical officer at the Arkansas Department of Health. She says you should still try and get a PCR test like the ones here at UAMS's drive-through site. But she says if you have to wait and are still showing symptoms, it's okay to assume you're positive.
Yes, and if there's other people in the household, you need to stay in a different room. If you have to go in the same room, you should wear a mask.
Dr. Klaus says it could be a couple weeks until we're past the peak of this, but the most important thing to have right now, she says, is patience.
We are really trying, and I know everyone is really trying to increase our efficiency so we don't have to have people wait as long so they don't get discouraged and leave.
In Little Rock, Ian Russell, THV 11 News.
Dr. Dillahay says the health department is buying about 1.5 million home testing kits for Arkansans. She says more information about where those will be located for pickup will be out next week. Important to note, they'll also be free.